The thought of Medicare for all, or even lowering the age of acceptance into that plan, scares many people. Do people really believe that we can accomplish this without substantial tax increases and even greater increases in our national debt? Over 10 years ago, we developed a plan to fund healthcare for all U.S. citizens and legal residents. We originally designated that plan a healthcare plan. However, it really wasn't a healthcare plan because it provided no information on actual medical issues, but only how to fund a plan that would ensure healthcare for all those residing within the U.S. We have since altered the name of this plan to a healthcare funding plan. In updating this proposal, we have also removed most tax and other factors, moving that information to the detailed written specifics of the plan. Almost half of all Americans have healthcare insurance through their employer, and the majority of those insured are quite satisfied with their plans. This proposal suggests that large group plans be formed that are not based upon where we work, that, for the most part, people may join any plan they choose, and then that plan stays with them from cradle to grave unless they decide to make a change, even when they switch jobs or go off on their own to start a new business. Our proposed funding plan will cover all U.S. citizens and legal residents, and will ultimately eliminate the need for Medicare, Medicaid, and the CHIP programs. This proposal also contains the mechanics for creating the equivalent of a single-payer system that's not a federal or state governmental agency. Please don't be frightened by the assessment of a 3.95 in an individual's income. By replacing the Medicare assessment of 0.0145% that is currently charged to an individual's income for future benefits under Medicare, the remaining amount in excess of that assessment of 2.5%, when met with the equivalent employer's contribution of 2.5%, will pay for an individual's current medical needs. And after an employer pays their 2.5% allocation, there will be no need to pay for any other health care insurance for their employees. In other words, if this funding plan is adopted, employers should save a significant amount when funding health care for their employees. In addition, we'd like to highlight the following 6 points. Number 1, since all Americans will be covered, pre-existing conditions will no longer be an issue. Number 2, deductibles and copays are based upon one's modified adjusted gross income, on one's ability to pay the deductible, with systems in place to cover insurance for those whose income is not sufficient to sustain such payments. Number 3, those laid off or terminated from employment, such as those laid off during the pandemic, for instance, having encountered difficulty in retaining, obtaining, or paying for healthcare insurance for themselves and their families, would now be able to maintain coverage under this new proposed program. Number 4, insurers that currently provide healthcare insurance for employer-based plans will be able to continue offering those plans, but they may now expand those plans to cover those not employed by the companies that they currently insure. Number 5, it is not necessary that this proposed plan be implemented immediately on a nationwide basis. A select group, region, or state might be selected. Any difficulties encountered may be tweaked and the program then expanded. Number 6, should this suggested funding plan prove to be successful, a similar system could be established to even replace our Social Security system. Please watch the following 2 videos. They explain the basics of the funding plan and provide additional information for employers, healthcare providers, and healthcare insurers, including an explanation of our suggested single-payer system. In addition, this website contains a written document explaining all the specifics of the plan in greater detail. If you are in favor of our proposed plan, or in favor of the basic elements of what we suggest, please contact your local congressional representatives and U.S. senators. We thank you for your time.